Welcome to the High Tea with Grace podcast, where we spill the tea on HIT. I'm honored to welcome Rebecca Woods and Sarah Richardson to the pod. Thanks for joining us, ladies. So nice to have you.
Thanks for having us.
So let's start with Rebecca. Tell me about the career path that brought you to what you do for work today.
Yeah, interesting path, sort of how I started out. I actually graduated from Plymouth State University with a communications bachelor's degree and minor in global tourism. So I actually started out in travel. And the lady that worked next to me, her daughter worked for Meditech. And so that's how I got in to HIT and started working for Meditech and just loved how it's all hands-on learning, which is how I learn. Worked my way up to be CIO in Vermont after a handful of years. And in 2018, went out and became an entrepreneur and founded my first company, Bluebird Tech Solutions. And then just 2 years ago, founded Bluebird Leaders, which is my 501c3. And we're creating a community to have more women in HIT. Woo!
All here for that. Sarah, how about you? Love to hear about your career path that brought you to what you do today.
Sure. It's been pretty nuanced and also 30 years plus. So the moments that shape you, I started out in hospitality. I have a bachelor's degree from UNLV and worked in the casino business for about 7 years. I morphed into opening a startup airline in the late 90s that went bankrupt. And I was in grad school at the time. One of my study buddies had a relationship with the CIO at the county hospital and they needed my skill set. So I pivoted into healthcare and I was already in IT at that point. So it really created this nuanced life of being able to start at the county level, which was pretty phenomenal to really understand academic trauma care, and then move to HCA and then HCA to other facilities, inclusive of a time with healthcare partners that was bought by DaVita, that was bought by Optum. Pretty fascinating. So my last CIO role was with Tivity Health. Loved it because I have a passion for senior care and senior wellness. And then now I'm with This Week Health. Been here about 4 months. Absolutely love everything I get to do, which is a culmination of 30 years of doing the things that you love to do best. Now I get to do those all of the time working with This Week Health.
That's awesome.
This Week Health is a media healthcare events organization, most notably. And we do a series of podcasts, events, city tour dinners. We now have advisory. We cover cyber and risk and executive development and just a myriad space of topics really designed to solve healthcare challenges one connection at a time. As principals, doing that across the country and continue to build a community that helps to ensure that CIOs are never alone in their journey because it's a very lonely job.
Yeah, it really is. And such an amazing thing for the three of you to bring your CIO backgrounds right into all of this. And you too, Rebecca, your kind of relationships from your past life in HIT consulting. So you guys sit in the middle of all of the trends happening in this space. Rebecca, you as like a women leadership kind of collaboration community builder, and then you, Sarah, as the CIO community builder. And so I'm very interested to hear from you on what innovations excite you the most. You're hearing about innovations all day long. Maybe I want to hear what innovations are so far out there that you think are just really cool. And then what innovations are really practical and pragmatic that you think are just really fascinating. Rebecca, we'll have you start.
Yeah, sure. So I'm super passionate about getting more women in healthcare, IT and IT in general, and really helping the group that's coming up rise up to be CIO or to be an executive or whatever it might want to be, even if it's a nurse rising up to be in informatics. So that's one of my deepest passions, and I'm super excited to turn that into reality now after all these years of working in the industry. But I think one thing that really excites me as well, and I've done some posts on it, is utilizing technology and how we're going to do that to move from sick care to care and what we're going to do to start moving that needle. It starts with food and technology and handheld devices and remote patient monitoring, all the way from ambient listening, and then go a little bit further. I think we're a little ways out, but it's starting, and how we're going to use genomics to start moving that needle as well. Just reading about that stuff is super exciting. They put all this junk in our food, and we need to start making better choices to just stay out of the hospitals and
Absolutely. And it's interesting when you think of that, it's almost like technologies together are changing models of care, which is fascinating to think of it that way. Sarah, what about you? What kind of excites you in the tech space that you're hearing about? It can be specific technologies or just models, whatever is interesting to you.
So I love that you just touched on the ability to stay at home. And all the research shows that you can live a longer, healthier, happier, independent life. More importantly, your ability to do those things at home and to have interaction with your caregivers in a way that allows you to make those decisions and not have to rely on facilities for sick care. So if you have those relationships with your physician, I'm a big fan also of things like precision medicine and genomics. If you start to add things like augmented reality and virtual reality, not just for medical training, but for patient education. And really what I love is reading more and more about pain management. So when you think about the opioid crisis we have in the United States, if you can use alternative therapies that don't involve actual opioids or other drugs, then you start to get in front of really the human element of what can make people have the ability to even use the digital therapies and mobile health apps to stay healthier. And so when you layer in that digital component of care, but you still realize that the purpose to me behind some of those things, and whether you're using AI and ML components for accuracy and diagnostics or patient outcomes, what's really important is if I can do that telemedicine visit and avoid just a routine care, that's fine. All these things about automation and all these amazing technologies, to me, are important because they allow the caregiver, the nurse, the physician, more physical time with the patient. Because when someone is truly ill or someone is at their most vulnerable, what they need is that human connection. And they need that human connection of person. And then you think about even during COVID, when what physicians really wanted to be able to do, or nurses, was just hold a patient's hand while they were dying. All the technologies are phenomenal, and they're phenomenal so long as they still allow us to create better opportunities for the human element inside all of these equations.
I'm very interested to hear how your roles changed as you went through your career. Like when you started your job as a CIO, Sarah, how did that change when you through the years, since digital transformation has been happening at a more rapid pace than ever now?
Sure. What changed the most was when we started talking about digital transformation. What I always found so fascinating about that is it's always been digital in the basement of a hospital back in the day. And we really used to think about maximizing some of our data center capabilities. And over the years, we got into colo, and then we got into cloud and storage and those different perspectives. They're important. It's really important to be able to understand now how cyber has taken a front seat in everything. It's in our personal lives too. So I feel like that's one of the easiest stories to tell is that cyber resiliency is at home and at work. I'm also really interested now in just the space of interoperability. And I remember putting in our first EHRs, and today it's how do you create a space where you're enhancing the EHR so it may be a component of the center of the universe, but there are one-off solutions that create a better ecosystem for your hospital. Organizational change management became an absolute passion of mine because getting the adoption of the technology and the ongoing usage to be optimized in a way that's beneficial to the organization, and then really watching that over a period of time, that's where the biggest lean in has been from where I started, which was just getting people to actually use technology as a part of their day to where it's everything that they do, and appreciating what those dependencies really mean for us.
So interesting. And you too, Rebecca, like how did your job change from start to finish?
Sarah and we started out when everybody was still on paper, and we're helping them through that change management of going over to technology and using computer. Cell phones have just came out. And when I was CIO in Vermont, we were the first hospital to send text message reminders out. Like that was evolutionary. And then fast forward all these years, and I'd agree with Sarah that there's a lot of pressure on security, and also seeing the role of the CIO change. I don't think it's so much pressure as everything's on the CIO now. It's almost nicer to see it spread out. There's CISOs, there's chief medical information officers. And so the role of technology is understood at an organization level that it's everybody's problem and everybody needs to adopt it. Obviously, the CIO is making changes, but it's also bringing in the team and the steering committees to help make those decisions. So it's really nice to see the evolution of the organizations adopting technology as a whole instead of back in the day. And it's one thing I brought to Vermont is let's bring the users together and get their opinion. But years ago, it was just like IT would pick that solution and it would get implemented, and you would hear across the country, right? This doesn't work for me. Too many clicks, whatever. And so to see that evolution has been really heartwarming and fascinating to bring everybody along.
Absolutely. And has the more empowered patient, we know patients are using tech to hack their health right now. Yeah. How does that impact the CIO's role? Are they asking users and patients more often how they're experiencing technology? Are they feeling like they need to start training patients on how is that impacting the CIO's role?
I feel like we're just at the cusp of it, right? I think in terms of the CIO, it's data and HIPAA and what are we going to do to keep it secure? I think that patients are scheduling online and text message reminders and that stuff is happening. I think that we're just at the cusp of the next level of what that's going to look like and being able to, I'm excited for when I can tap my data, just like I'd share with Venmo or share money with whoever to my phone to a provider and that uploads my history from out in California and I bring it over to Boston or whatever it might be. I think we're just at the cusp of that and it's going to be really exciting. I truly think that the patient should be owning their data and start taking a better ownership of that. And I think that's a wave that's coming as well.
Couldn't agree more. I'm a huge proponent of that. Yeah. Patients really just owning their records, owning their data. Nobody else is going to be responsible for the quality of your data like you will be, right? So Sarah, I'm interested with all of this digital transformation happening. What are you hearing are the greatest barriers to entry for these folks or barriers to implementation of tech?
Sure. I think about the barriers to technology. Often you hear me say it in the beginning of the adoption factor of understanding that anytime you're going to put something into an organization, especially that it'll either be enterprise-wide or have a significant impact or lasting impact on patient care, it's not with the C-suite making just the decision. It's the entire change population that has to make those things happen. You need a champion not only at the executive level who owns the outcomes, you need champions inside who are making those things happen. We learned that through how many botched deployments of computerized physician order entry or trying to get the carts on wheels out originally, or just some of the technologies 20, 25 years ago, which sounds dated, but the things we learned about how to do those things effectively have carried over into the fact that there used to be one or two big things a year. Now it's consistently and all the time. Your portfolio and your governance and your ability to figure out what happens next is massively tied to your resource allocation, to your ability to understand how you have the right partners who own it. Rebecca's point, IT used to own everything. IT really shouldn't, quote unquote, own anything other than some of the infrastructure keeping the lights on. All those applications need to have business owners. They need to have product owners. And no choice should be made without a business owner and a product owner in that mix. And with all of those things being said, barriers today are everything from low margins or no margins in some facilities. I had a dinner last night with 15 CIOs here in Denver. And one of the top items of discussion is, how do we afford it? Some places have an $800,000 budget because they're critical access. Some places have multi-billion-dollar budgets. End of the day, when you're in a community like Denver, as an example, those patients inevitably are going to go in between these facilities. And so interoperability and access to your record is still a big deal. What happens when you go to a vacation location and you get injured and how are your records following you? They're not. So those are some of the things I still think about is how do we make healthcare simple for the consumer and also in a way that the technology isn't a barrier to providing the care that the clinicians and physicians want to be able to give.
Rebecca, I'm interested to hear your thoughts on this too. Very great insights, Sarah. It's really interesting to see the heart of the CIO, right? And what are their pain points here? Those are really fascinating to hear about. Rebecca, what are you hearing? What are some of the pain points that are keeping CIOs and hospitals and health systems from really moving forward on digital transformation?
Yeah, aside from security, which is always front and center, I think there is digital transformation is happening. I also think that the organization needs to give the opportunity to the CIOs and their VPs an opportunity to get out there and see what's happening. I feel like some are still in that bubble. And so allowing them to go to conferences and talk to the big bad vendors and actually see what they're doing and what they're bringing to the table and learn about what's coming out there and being educated on the opportunities that these vendors have, even if it's a startup and they might take something on as a beta tester for the organization, which might be a little bit cheaper, but come out as a win in the end. And building those relationships with those types of vendors is going to really help the healthcare IT as a whole move forward. And so I think years ago, it wasn't as welcoming. I see that more with a lot of the conferences coming out. And I still feel that people need to get out there and educate themselves to be able to choose the right solution for their organization.
It seems like if you have more time on a personal level with a CIO, you have more of a chance to explain your value proposition, how you differentiate yourself in the market, And when you're doing these conferences and you're seeing them regularly and having regular conversations, a lot easier to move that sales cycle along, right? Versus just having a conversation.
Yeah, it's about relationship building, right? And it goes on both sides. There needs to be trust on both sides. You need to build those relationships. The vendors need to prove that they can do what they're saying, right? And so that builds over time. And then being able to have that referral to that hospital that they had set up or a couple and the CIOs can talk to each other. There's huge benefits to this. And that's how we're really going to be able to move healthcare forward in a more lightning speed situation.
I know.
Picture when I was CIO over 10 years ago when I started, and I took a team to HIMSS in Vegas, and HIMSS had one of those photo booth things. And behind me, it says, send the fax machine back to 70 or whatever it says. I still have that photo. And I'm like, God, they're still here.
So I would love to hear about the collaboration that you guys have together. So Sarah Richardson with This Week Health and Rebecca Woods with Bluebird Leaders. I'd love to hear a little bit about how this came about and what you're planning to do together as you collab.
I'd love for you to start.
I'd love to start. I think this is a perfect example of organizations coming together, building that trust and that relationship. So Bill and I have been talking since I almost launched Bluebird Leaders. We've had conversations, we've done drive-bys, we've done lunches, and just getting to know each other and feel each other out. It's almost how you do a job search, right? As an executive, you're not just going to jump and not know anything about the organization. I really value what Bill brings to the table and his leadership and his mentorship. And so over the beginning of this year in 24, we started talking about what our relationship would look like and how This Week Health can help Bluebird Leaders and vice versa. And so we came to the decision that This Week Health would really help elevate the conference, our annual SOAR conference, which is coming up September 18th through 20th in Atlanta. We have about 7 tickets left. So they're really helping us with the staff and the amazing staff like Sarah. I get to work with Sarah Richardson every day. Woo-hoo! The staff behind This Week Health, Bluebird Leaders, is really just me and a couple others that have helped and collaborate with them on calls. It feels like I'm part of a team. So it's been really great.
It truly is fantastic because Rebecca and I knew of each other for a long time. We'd walk by in hallways, see each other, and just the name was always there. And then it was only a couple of years ago, we literally just one day were like, hey, let's do more stuff together. And then when I made the choice to join Bill's team full time in May, it was that catalyst to say, okay, we don't need to create a women's track of This Week Health because I'm a woman joining the team. It's, hey, how do we continue to create spaces for women to be uplifted and amp up their profiles? We've already been having these conversations with Rebecca. Let's figure out how to do something with Bluebird Leaders. And so we have a long-term agreement to partner and work through different opportunities and ideas. And it's such a nascent stage where we're like, yes, we're going to support SOAR. There's so much more to it than that. The ability to realize like how you figure things out together. And it doesn't always have to be perfect. And the reason I say that is Bluebird Leaders just turned 2. I've been here for 4 months. As we understand the dynamics of how to do things well and each time doing better, we're all about healthy conflict, healthy dialogue, figuring things out, going, oops, that didn't work. This did work. Let's figure these pieces out. That creative startup mentality, because This Week Health really is still in startup mode. Bluebird Leaders is in startup mode with Bluebird Tech. You start bringing those mindsets together, and the art of the possible, which is one of those things that just makes me tick all the time, is what can we do together? It's never about what we can't do. We have to rope ourselves back in sometimes. So you get 50 great ideas. Let's be honest, 1 or 2 of them are what you can focus on and deliver at any given point. So we're at the beginning of what will continue to be something truly phenomenal together. And what's most important is that women see women supporting each other and doing things together that maybe you couldn't do by yourself. But the point is you don't have to be alone when you're a part of This Week Health and Bluebird Leaders.
So interesting you say that because I was just at an event this past weekend and there was a woman CIO there and she said, I'm just so lonely all the time. It's just 10 to 1 men to me. It's only me in every room that's a woman. And I just wish I could collaborate with other women in the space and hear how they're thinking and creatively. And they go out and they do their golf, but I'm left behind because I don't really like golf unless I want to go be terrible at it, right? So it's great that you're building this space for these women leaders who are used to being 10 to 1 to be able to be together and help learn from one another and connect and grow.
It is. It's lonely at the top as a healthcare CXO and then it's lonely at the top as an entrepreneur, right? And then layer on that we're not as diverse and there's less women. And so to have a place to collaborate with women, whether it's Bluebird Leaders or a city tour or your high tea, Grace, that you just hosted, which was just phenomenal and looked awesome. I'm drinking my tea now and I can't wait to go next time. So just a safe place, right? And then to build that network and those phone a friends. I have this phenomenal network that you can send your feelers out and people that have helped and just surround. It's like a big hug. It's great. We want all the women to be on the nest and collaborate together, right?
Absolutely. And remember that if you see another woman in the industry that you're like, wow, I really admire that person, say something because you may be able to collaborate and build something beautiful. So now I want to dig into your personal lives and what helps you work your best and make a difference. You guys are busy professionals. You've had successful careers and continue to work your best every day. And it's inspiring to see. So what are things that you do to keep yourself at the top of your game? Sarah, let us know what you do. What do you do to stay strong and focused?
Sure. I'll start with just the physical component, because if you're not getting enough sleep, you're not getting enough hydration, you're not eating healthy, you're not exercising, you're putting yourself at a different advantage from the very beginning. So take care of the basic blocking and tackling elements. And if you're on the road and you've got kid care and elder care and all kinds of things that are happening, you can still fit it in. So take care of you first, because if you don't, you're not going to be able to take care of everybody else. And everybody depends on us to take care of them. I'm also in a very healthy marriage. I tell people that because I know the difference between one that's not and one that is. I have the most amazing husband. We've been together over 11 years, and understanding of I'm gone half the time. He actually totally loves it because then he gets to do his stuff while I'm gone. But when we're together, we're intentional about that relationship and really making sure that each other has what they need to be the best version of themselves. Having a healthy work culture is really important. I've worked in horribly toxic environments. I've also created amazingly healthy and productive environments. And so when I joined This Week Health, it was because that's the intentionality that Bill and the team put forward, and that's the energy we bring forward to others. When you create something that is very unique and special, not only is it evident in how you show up and how people experience you, it's also contagious. And so when you are thoughtful and you are kind and you are intentional about the way you show up for yourself and others, it has a reciprocity and an amplifying effect for others. I think of the exponential impact of being nice to somebody. It's amazing what a smile can do. And for what we do, the empathy we bring to the table, we're in healthcare because we care about people. And when you are genuine in that aspect, then other good things happen. And I was at HCA for a long time, loved my journey there. I always said that good people beget good people. And I will live by that mantra for my entire life. And so I'm grateful that I get to take the best elements of what it means to give back every day in my career.
Powerful. Rebecca, I'd love to hear from you too. What are things that you do? And also I'm interested to hear, what are you hearing from other women in your community? What are they doing to stay focused and on the top of their game, Rebecca?
I agree with Sarah. It's keeping in check mind, body, spirit amongst multiple jobs and 2 children and Ubering them around everywhere while on a conference call and trying to give them snacks while telling them to be quiet because this is a recording. It's crazy, right? Yeah, it's crazy. And then we just got a puppy. Yeah, let's throw that into the mix. That's great. So literally paused the call yesterday and had to turn off camera because he decided to do his duty right there in front of me. And I'm like, I can't smell that. I can't stop. I think it would be left out to say that as moms and women, our life is a little bit crazy. And so for me, I go and run, walk, or I bike. I do triathlons. And so I'm run, biking, swimming. I have to do something. I also have to do something because my ADHD and my brain racing as an entrepreneur all the time, if I don't go do that and have that space to think and know that the technology isn't going to be ringing at me, I turn it off purposely. I need that space to set myself and center myself. But I also think I come from a gymnastics background, and I know being a gymnast and the level that I got to, that failure is okay. The many times I fell over and over again, and bringing that to the teams and being a leader that allows the team members to fail, gathering back together, learning from that, and then setting them off to fly again has always been important to me. And as a leader, I just always want to be relatable and lead with kindness. When I was CIO, I've told the story before. You come in your suit and heels, and it's intimidating. And that's not what I want to be. I want to be part of the team. And so I would take my badge off very frequently when we had big decisions to make and say, I have this card, but not laying that down. We need to decide this as a team. And that made me more relatable, more trustworthy with my team, and made me more approachable. So when there really was a problem that we had to talk about, they were comfortable with bringing that to the table.
I love that, leading with authenticity and understanding that there are going to be failures and there's going to be hard cultures, but at the end of the day, you are the change. Thank you for sharing that. To finish off this conversation, I'd love for our listeners to figure out how they could find you online.
LinkedIn. I'm all over it.
Fantastic.
We are all over LinkedIn every day, all the time. We often will repost and mention each other.
That's terrific. And before I forget, did you happen to bring tea with you today?
Oh my goodness, my mug. This is my Proto Technology mug. I'm an advisor to Proto Technologies, which is a growing MSP in Atlanta. Their CEO is a female, and her name is Marissa Maldonado. She leads with authenticity. She has some of the best culture I've ever seen in an organization. They're a growing MSP that supports the majority of the healthcare industry. The mug is surrounded by all other stickers that I collect at conferences and stuff like that.
I love that.
All the way. Always.
Sarah, what about you? What is your mug?
So it's actually Harrods, which I figured, oh my gosh, if we're going to be talking about tea, what is more of an homage to it than Harrods from London, of course? Because you get into the habit of when you're over there, you drink tea and then you come back and you're like, oh, I liked tea for breakfast. A little tea and a little milk and a little sugar. It seemed weird at the time, but it's not. So it's just straight up breakfast tea this morning because it's easier. And I'm on the road and someone else's house. I'm like, what do you have for tea? And they actually had that this morning, especially too, is one of my best friends. She's also an exceptional Sarah Hayesbrook. Her daughter, Katie, is going to do a semester abroad in London and starts next month. I don't have kids myself, but I basically adopted hers at one point in my life. So being able to see her thrive as a young college student going abroad to study history and the things that she loves most, it's so rewarding to be a part of people's lives on multiple journeys from when they're kids to now they're adults. And even though they're adults, like they're still in college, they're scared about going overseas, but they're excited about that opportunity. So again, it's women lifting up women and all journeys of your life. So this is an homage to both Katie's journey to London in September, but also because we had the opportunity to spend this morning with you, Grace. So thank you for that.
Absolutely. Yeah, thank you so much.
About pink.
And you'll have to have her bring some Harrods tea back for you from London. Thank you guys for joining us today. We really appreciated the opportunity to learn from you both.
Thank you so much. It's been great.
Thanks, Grace.
And thanks to you folks for joining us too. Check out the High Tea with Grace podcast website for more great interviews with esteemed guests like Rebecca and Sarah today.
Like a Girl Media is more than a media network. It's a community. We want to meet you and amplify your voice and the voices of outstanding women innovating in healthcare. Interested in starting your own podcast or hosting an event near you? Connect with us online or in person. We're here to support and empower you.